بسم الله الرحمن الرحيم. السلام عليكم جميعا، معكم ليان السند المودريتور لهذا الويبينار. اليوم الويبينار بيكون عن Dermatology Attachment and Service مع الدكتورة ريم بن إدريس.
السلام عليكم. نبدأ ليان.
أي نبدأ.
أوكي. السلام عليكم جميعا ومساء الخير. الله يتقبل منكم طاعتكم ورمضان كريم. أول شيء شكرا ليان على الاستضافة والتنظيم، والله يكتب أجركم إن شاء الله. أنا ريم بن إدريس، واليوم بعطيكم a comprehensive overview of the clinical attachment process in dermatology and service jobs in Riyadh. حاولت أرتبها لكم بالطريقة اللي كنت أحتاجها لما كنت مقبلة على هذه المرحلة عشان توضح لكم الصورة كاملة. حطيت لكم QR كود بالنهاية للي يبغى نسخة للعرض. كل شيء بيكون موجود لكم إذا احتجتوا ترجعون له بعدين. So let's start. First of all, we'll tackle the timeline. I drew this up as a suggested timeline from me. It's all amenable to a certain degree. Preferable timelines are aligned in line with the Saudi Council for Health Specialties requirements, and they're illustrated in solid borders right over here. Timelines may vary depending on the year and Saudi Council deadlines. However, this is just a general concept. So starting from June 2024, this was the last month in my internship, and ending in May 2025, which is when the matching portal closes. Results are announced in June, على خير إن شاء الله. And in January, this is when the Saudi Council for Health Specialties application portal opens. By this time, you're supposed to have completed a 6 months long clinical attachment in dermatology, plus working in a healthcare position. So in order to complete a 6 months attachment before the portal opens, you have to start immediately after your internship. So here in July, which is the preferred timeline for clinical attachment. Other options include postponing it 1 month, therefore starting in August, and having a month off just before starting. Some centers will agree to this. However, you have to make sure to get a clear agreement from the program director or the person signing your clinical attachment. Since you're going to be finishing in January and starting in August, most will say yes, but just double check first. Other options include starting at any other time. Some people only started in October or even after that. However, they made sure to have an agreement with their doctor that will sign for their 6 months of training application beforehand. If this is the route you want to take or might end up having to take, just make sure that the doctor agrees to sign it first. Moving on to service job, you just need to have an active service job during the time of application, so here in January. Therefore, my preferred timeline was starting service in January, okay? You can start immediately after internship if available, or any time between July or January. Again, as long as you are actively employed during the application, it's okay. You have to continue your service job till the grades are posted, which was here, 18th of March for us. Afterwards, it's up to you. You can continue or quit. So let's move on to the attachment. I'll be discussing public versus private sector, the application process, and tips. So what you need to know about the attachment is that you just need a Saudi council licensed or classified consultant to sign it for you. It doesn't matter if it's done in a private practice or public hospital, or if the doctor is a program director or not. The total has to be 6 months. However, it does not have to be consecutive. We only had 6 months between finishing our internship and when the portal opened, so technically it had to be consecutive for us, following the preferred timeline, as I showed you previously. But like I told you, you can split it up as you wish, as long as the doctor will sign it for you. The attachment can be split into 3 months each. However, you cannot split them into less than that, because only 2 doctors are allowed to sign your application for you. When to apply? You should start applying as soon as possible. If you haven't already, then you should start today, as seats fill up pretty quickly, talking about the public sector, of course. The requirements include a Saudi Council classification for applying. Most centers will require this. Since you'll most likely start applying now as interns, you can just inform them that you will have it as soon as possible and try your best to continue with the application process till you get it. Most will not mind this since they know the situation. However, they will request it before starting, so make sure to get it done as soon as possible. After finishing your internship and receiving your degree and certificate, just upload them to the Saudi Council website to get the classification done. Keep in mind, this will take about a week or so. Some centers do prioritize council classification, so do not neglect it. Moving on to the medical insurance. Some centers will require a valid medical insurance, which also require the council classification, which is the previous point. So just like the previous, you can get it. This is also important for service. So make sure to get it in. You can apply for it through any insurance company and cost Riyadh, which is the lowest coverage for a GP. However, دايما في خدمات وطني ويوم التأسيس وهذه الأشياء, so you can keep an eye out for that. Other requirements in filling out the center application. So make sure to have the department secretary send them over to you as soon as possible so the department can process your request. So contact information, point of contact for each public center. وأقصد فيها المستشفيات الحكومية عندنا الرياض. Again, I'll have a cue for the end of the presentation for a copy, and the credit go to my colleagues for their help in gathering all this information. King Khalid اللي هو مستشفى السعودي مخطب, he direct department secretary is Miss Ava, and the applicant is through mail Misa. You can talk to Dr. Reem if you have any difficulty. She's very cooperative and will help you. Move on to
ريم بس شوي يقطع.
السلام عليكم.
وعليكم السلام.
صوتي كويس الحين ليان؟
ايه كويس الحين.
ممتاز. خلني ارجع أجل. واضحة الشاشة الحين صح؟
ايه واضح.
اوكي. طيب ايش النقطة بس عشان ارجع عليها؟
شوي بدأ يقطع
هل
مرات.
كان الحين يقطع؟
ايه شوي يقطع.
اوكي. كيف الحين؟
الحين زين.
زين تمام. أجل خليني أرجع أعيد لكم بداية الصفحة هذه. أول شيء عندنا King Khalid University Hospital. The application is through emailing the department secretary, who is Miss Ava, and this is her email. However, if you face any difficulty, you can contact Dr. Iman, who's the program director. Moving on to National Guard Hospital, اللي هو الحرس. Dr. Rayan Al-Khadir is the program director, and applications are through emailing him. Due to high demand this year, I heard that they are prioritizing people who have previously worked with them or have an active research with their consultants. So keep that in mind. Moving on to Prince Mohammed bin Abdulaziz Hospital. I've heard that everyone there is very cooperative. This is their contact information. And just keep in mind that it's a cluster 2 hospital, so all PHC cases get referred there first. Moving on to King Abdullah University Hospital, which is the Princess Noura Hospital. It's a small department, but I heard everyone there is excellent as well, and the load there is less. So it's going to be nice. The consultants are few, so everyone there is going to remember you by the end of the rotation. However, they do not have a program, so keep that in mind. There's also King Saud Medical City, اللي هو شماسي. They prioritize applicants with a valid Saudi Council classification, and fees are included. Their clinics start at 4 p.m., which is a great option if you're working service in the morning. There's also King Fahad Medical City. The application process is lengthy. You have to email the secretary and Dr. Ibrahim Al-Freih, who is responsible for all the attachments. Just make sure you get a confirmation email from both of them before solidifying your attachment there. And inshallah, it's going to work out well. Moving on to King Salman Hospital. I could not find any of their emails, so you'll have to go talk to them personally. So I listed the name of the department head and the program director and their clinic days right here, Mondays and Thursdays. So moving on to application process for the private sector. It's a great option if you started late or could not secure an attachment in your preferred center. You can ask the program director of your preferred center to attend with them in their private clinics, but you have to be persistent. You have to make sure that you get their approval first. Don't just go there. Once they agree, ask them if their private clinic or hospital has any requirements, as some hospitals do have requirements for attachments or interns or students, so double check. And clarify that you will need them to sign your application for you. Perks of doing your attachment in the private sector include that you will have one-on-one exposure with the important doctors for the interviews, compared to an official attachment where you will cover many clinics with multiple consultants based on the schedule and might not get the exposure that you want with your preferred consultant. And their schedules are flexible since you will mainly just be observing. They will not rely on you to do most of the work as opposed to official attachments. So how to make the best out of your attachment? Take the opportunity to start research projects with your program directors or department heads. Take any opportunity to present, whether during clinics or after clinics, during grand rounds or department activities. You have to be proactive, show interest, read about interesting cases you saw in the clinic, stay updated, try to master the common diseases. Always volunteer to help, ask to open clinics, take history, do procedures with the team. Try not to be late, however, as negative impressions are worse than no impressions. Try to be friendly with everyone, including the nursing staff, the students, the seniors, etc. So moving on to service jobs. I'll also discuss public versus private sector service jobs, application process, and tips. So service in derma is rare in Riyadh. However, if you do have service in derma, that means you do not need an attachment in dermatology. However, you will be missing out on making connections with the center of choice, since most likely the service is not going to be in one of those centers. You only need to work a service job when the application portal opens and until the grades are posted, which, like I said previously, is until 18th of March in our case, and not until when the application portal closes. I double checked this with the Saudi Council, so just make sure you stay in the service job and don't quit. So let's talk about the sectors. First, the specialty. In the public sector service jobs, dermatology is rare in Riyadh. However, I've heard that King Salman in previous years did offer it, and maybe Prince Mohammed bin Abdul Aziz. However, there's nothing secure, and it will most likely require a wasta, so it's not something that I would waste my time on. Dermatology is available in the private sector, though, mainly in smaller dermatology clinics, and again, you might require a wasta. You can work in any other specialty, though. They all count. It does not matter. From my experience, public sector jobs are more strict when it comes to their starting date and will move on if you postpone it. However, private sector jobs are more lenient. Um, there's more money in the public sector as compared to the private sector. The salary is about 15 to 18,000 in the public sector, and it's going to be almost 9,000 in the private sector, which is the basic salary. If you're planning on doing an attachment and service at the same time, your service will have to either be nightly, which is most likely private sectors, or not every day, which is most likely going to be ER specialty, unless you find a cooperative department or hospital that is willing to let you take time off for your attachment. If you're applying to the public sector, always go for hospitals like مستشفى الدرعية, مستشفى الملك سلمان, ولا مستشفى الشماسي, etc., as they treat you like a resident. Everything has to be approved by a senior first. This is a very important point, because if you go to PHCs, primary healthcare clinics, and centers, they're going to treat you like a consultant. This is, of course, based on your center. However, my experience is that there is no senior around. Everything is in your name, and it's all your responsibility because you're a general practitioner. So there's no one there that's obligated to guide you or help you, and it's in your name at the end of the day. So this is scary, and I advise against it if possible. Also, you might only find jobs that are outside of Riyadh for the public sector, like في الخرج ولا الحوطة. So you have to keep this in mind when applying. So let's move on to tips. You have to start applying early. King Saud Medical City, اللي هو شماسي, opens their application online and very early. I think they opened it in July in our case. So if you're interested, keep an eye out for that. Others, including Al Haras and private sectors, also have online application portals, and they do open every now and then. So you have to keep their websites saved and just double check them every now and then. Other hospitals like Dir'iyya, Al Malik Salman, Cluster 2, their application is via HR emails, going there yourself, and you have to be persistent. You have to go multiple times and print out your CVs and take them with you. أي وقت تلقون فيه فراغ وأنتم قاعدين تسوون الاتاتشمنت روحوا. أنا كنت أول 3 أشهر في الاتاتشمنت، آخر شهر اللي هو كان سبتمبر تقريبا وأغسطس سبتمبر أكتوبر نوفمبر تقريبا، كنت أي وقت ما عندي عيادة أروح الدرعية ولا مدينة الملك فهد، أكلمهم أعطيهم السي فيز لين ما لقيت مكان الحمد لله. If your service starts while you're still doing your attachment, you have to give your attachment a heads up. Most of them are willing to cooperate, however, not all of them are. Some will treat you like residents in your attachment and have a strict schedule for you. You're obligated to cover morning and PM clinics every single day of the week. So if you're planning to do both, just give them a heads up early. Try to find a way that's suitable for both, and make sure that they gave you the agreement first. Always try to prioritize your attachment. However, not all centers will cooperate. So the attachment is a priority to me. It has more points, and the center is going to know you. And if it doesn't work out with your service, just know that in the end, Al Habib is going to take everyone. So that's always a plan B. Okay. Moving on to just general tips about this year. Let's talk about finances first, or when you should quit your service. This depends on you and your center and how comfortable you are there. If it's a nice center and you're comfortable, you can always stay there and save up some extra money. Remember, there's a bunch of fees for publications, applications, conferences, matching. Also, some attachments have fees included, like الشماسي and مدينة الملك فهد الطبية ممكن يحطون رسوم هذه السنة. Also, you have to save up money for the vacation you're going to take after this year, which is mandatory at this point. You can also use this year to beef up your CV. There's plenty of time to do so. If it's lacking in research, you can work on that. do some campaigns, conferences, etc. Always ask for recommendations and references from the doctors you worked with. You should also take this year to figure out if you actually want to pursue this path or not. It's totally okay if by the end of this year you realize that this is actually not the path for you, or if the opposite happens and you find out that you do want to pursue this path even more now. It's all going to work out in the end, inshallah, no matter what outcome. Trust me when I tell you this time flies by this year so quickly. أحس إني توني مخلصة الامتياز والسنة تمر مرة بسرعة. So make sure at the beginning of the year you write out a checklist for yourself. Whatever is lacking in your CV, try to finish it early, try to gather everything you need, and get all the work done. Don't forget to enjoy it. It's actually a nice year. You do have some freedom to go wherever you want and do whatever you want. You're not restrained to any one place or specialty. You're going to meet so many new people and make so many connections that, inshallah, will last you a lifetime. Make sure to do all the things you always wanted to do before, but just never had the time to do so. And try to be flexible. Not everything is going to work out the way you want it or the way you planned, or it might not follow the preferred timeline as well. However, just be flexible, try to get the most you can, and it will all work out, inshallah. So that's it for my presentation. This is the QR code for a copy of this presentation if you want it, especially for the contact information for the centers. And that's it. If you have any questions, let me know.
يعطيك العافية ريم. ناخذ 5 minute break لما يكتبون الأسئلة. اللي عنده أي
Okay.
سؤال يكتبها في ال Q&A.
تمام.
Ready for the questions, Reem?
أي جاهزة.
طيب أول سؤال، هل في أولوية بالرياض في السيرفيس والأتاتشمنت زي المعدل وغيره؟
على حسب السنتر. صراحة أغلب السنترز أولويتهم لو كان زحمة هم لو يعرفونكم أو لا، وإذا قدمتوا أبكر أو لا. العادة أبكر ناس يقدمون هم اللي يأخذونهم، زي الجامعي والملك فهد. الحرس الأولوية للي يشتغلوا معهم من قبل ويعرفونهم. فالمعدل وباقي الأشياء ما هي مرة مهمة صراحة.
طيب كيف أقدم على السيرفيس؟ هل عن طريق المستشفى أو في موقع عام حق مستشفيات؟
السيرفيس على حسب وين تبغين تقدمون. في أكثر من مكان، في زي وزارة الصحة اللي هي أي مستشفيات تابعة للتجمع، زي المراكز الصحية أو مستشفى الدرعية، ومستشفى الأمير محمد، وهذول كلهم يتبعون لوزارة الصحة. فعن طريق وزارة الصحة تقدمون، هم يفتحون كل فترة وفترة وظائف، لكن أنتم المفروض يعني تفتحون لكم أكاونت وتسجلون just in case، وقدموا عن طريقهم. أنا جاني قبول في الدرعية بس من هذه الطريقة، يعني ما رحت كلمتهم ولا شيء، هم طلعوني من الموقع وكلموني. أما بالنسبة لباقي المستشفيات زي الحرس يفتحون هم موقعهم، لو تكتبونه أونلاين عندهم National Guard Hospital و Look for Jobs وينزلون. الشميسي عندهم موقعهم الخاص وينزلون فيه وظائف. في بعد المستشفيات الثانية الأهلية زي الحبيب وهذولي عن طريق مواقعهم. لكن في نفس الوقت لازم مع كل هذه الأشياء تروحون in person، يعني حتى لو ما قدمتوا أونلاين بعض الأحيان عادي ياخذونكم بس عشانكم رحتوا in person. عشان كذا أقول لكم اطبعوا السي فيز وروحوا. وبخصوص المواقع وكيف التقديم وهذه الأشياء تلقونها كثير في تويتر، أول ما يفتح تقديم ينزلونها. فأكاونت زي فير وهذه الأشياء كل شوي ينزلون.
طيب السيرفيس والأتاتشمنت بالعادة كم ياخذون وقت عشان تجيك الموافقة؟
العادة بسرعة صراحة، يعني إذا ما كان في إجازة يردون عليك بسرعة. أحس في الوقت الحالي يعني أعطوهم أسبوع، إذا ما ردوا لكم خلال أسبوع روحوا كلموهم in person. يعني لو الحين أنتم مقدمين في رمضان وعلى بعد إجازة العيد ما أعطوكم خبر، روحوا كلموهم in person، لأن أعرف أن المقاعد بدأت تتعبى already.
طيب هل في جروب للسيرفيس والأتاتشمنت بتليجرام؟
في جروبات سيرفيس ايه، بس الاتاتشمنت ما اعرف لو في واحد يعني للديرما سبيسيفيكلي او لا. لكن في جروبس السيرفيس واتاتشمنت ان جنرال، في واحد اسمه سيرفيس ريزيدنت، واحد اسمه residency and service interview questions. I'll try to find the links if you guys contact me أنا حطيت لكم هنا ترى ماي تويتر وإيميل I'll send them to you إذا تبغون.
طيب ال next question، هل لازم المستشفى اللي باخذ عندهم attachment أكون أخذت عندهم في شهور الامتياز؟
لا مو بلازم. آم، لكنه يعني أزين لك. أعرف كثير يعني قدموا على مدينة الملك فهد وأخذوا عندهم elective في الامتياز بس عشان يعرفونهم ويقبلونهم إذا قدموا، which did work out من صالحهم يعني. لكن في كثير راحوا وهم ما قد راحوا لهم من قبل. أنا سويت عندهم attachment وأنا ما قد دربت عندهم من قبل. فلا تخلون يعني هذا يكون عائق لكم، وإذا ما ردوا لكم دايم دايم روحوا كلموهم in person و be persistent. That's how you get the attachment صراحة.
طيب بخصوص الاتاتشمنت كيف أرسل لهم التصنيف؟
هم بيطلبون منك، ما يحتاج انت ترسلين. يعني انت لما تكلمين البروجرام دايركتور ولا السكرتيره ولا كذا وعطوك القبول المبدئي بيرسلون لك the list of requirements، منها الفورمز حقت البوست جراد، ولازم ترسلين الهويه وهذه الاشياء كلها، من ضمنها الكلاسيفيكيشن. فبعضهم اذا قلتي لهم انه بترسلينها بعدين عادي يرضون، بعضهم لا بيسوون لك سالفه. اذا سووا لكم سالفه ارجعوا كلموا البروجرام دايركتور وقولوا لهم ان لسه ما طلعت واحنا انترنز وترى كل سنة تصير هذه السالفة، وبيتفهمون بيقولون خلاص أول ما تبدون ارسلوها.
طيب هل في سيرفيس في مستشفى قوى الأمن؟
اي ممكن إني ما قلت هذه النقطة. طب في المستشفيات في مستشفى قوى الأمن ومستشفى العسكري. هذولي في السابق كان عندهم سيرفيس، كان عندهم اتاتشمنت سوري. لكن هذه السنة ما أعرف أحد سوى عندهم اتاتشمنت. أما السيرفيس قد سمعت إنه مرة قد كان فيه، لكنه يعني قبل فترة والله، يعني يمكن 3 سنين أو أكثر. وما سمعت إنه فيه أي شيء الآن.
طيب متى تنصحين نبدأ نشوف المستشفيات بخصوص الاتاتشمنت؟ يعني آخر شهر بالامتياز ولا متى؟
لا، أنا أقول الآن. يعني إذا ما أرسلتوا ارسلوا إيميل اليوم. خذوا البيج حقت التقديمات وارسلوا لهم اليوم.
طيب أنا بدأت أول شيء attachment ووفروا لي سيرفيس وأنا ما خلصت 3 أشهر. إيش أسوي؟ أكمل attachment ولا أبدأ سيرفيس؟
إذا بدأت أول شيء attachment ويعني جاز سيرفيس وهي لسه ما خلصت 3 شهور، أوكي.
إيه.
صراحة I would continue الاتاتشمنت، خاصة إذا كان center of choice عندك. إذا تبغين هذا السنتر، مرة بيفرق معهم لو فجأة تركتيهم ورحتي عشان سيرفيس. It's not gonna look good أبدا. إذا قدرت يعني تنظمين مع السيرفيس يعني عطوك مهلة لما تبدين معهم كان كويس. إذا ما قدرتي وقرب أصلا جانيوري وخايفة تروح عليك، هنا أتفهم. بس لو أول 3 شهور صراحة صعبة and it's not gonna look good. ف I would just أسحب على السيرفيس صراحة.
طيب في two questions عن الريسيرش إذا عادي.
أوكي.
في question يقول I'm graduating next month and I have no ongoing or published research in dermatology. In your
مهم.
personal opinion, what's the best way I can reach out for opportunities? Am I too late?
Am I too late? If you're doing service and attachment, of course not. حتى لو يعني you're planning to apply this year, it's still not too late. أهم شيء يكون عندك active or ongoing research، يعني minimum خلاص that's good. You can start research at any time. ما يحتاج يكون published، يعني صح إن publications وأعداد أكثر أفضل، لكن everything else in your application is amazing ما راح تفرق. لكن إذا كان السؤال على during ال attachment to service year, it's very 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 doable. يعني عندكم 6 شهور قبل ما يفتح التقديم أساسا. 6 شهور هذه تقدرون تبدون فكرة، تاخذون IRB you publish، um, ويجيكم الموافقة على الببليكيشن من قبل ما حتى يفتح البورتل. وkeep in mind حتى لما تفتح البورتل you still have an extra 4 months لين المقابلات. So in total you have almost 10 months to work on research. وأفضل طريقة تلقون فيها research هو أنكم تروحون تسألون دكاترة in person. If you have ideas that's great. كيف تطلعون أفكار من خلال يعني حضوركم في الكلينكس. إذا في أي شيء interesting بتطلعون منه فكرة that's good. ما عرفتوا just search other topics, recently published topics online، وشوفوا what they recommend for new topics وتقدرون تطبقونها. تقدرون تسألون الدكاترة نفسهم إذا هم عندهم ongoing research يقدرون يدخلونكم فيه، أو just tell them your idea وقولوا لهم إن أنتم تبغون تشتغلون معهم. أفضل شيء طبعا program directors ولا الكوميتي حقت الانترفيوز عشان تشتغلون معهم عشان يعرفونكم أكثر. إذا ما لقيتوا معهم كلموا الريزيدنتس أو your fellow attachments أو interns. كلنا نساعد بعض صراحة. أنا طلعت بأبحاث مرة كثيرة هذه السنة بس من زملائي، يعني ما قصروا. كلكم تتعاونون، كلكم يعني عارفين the struggle of research، وكل أحد يعني بيحاول يدخل بعض بس عشان تخلصون الشغل وتنشرون بسرعة. ف don't stress this أبدا، بس just talk to everyone you see.
طيب في سؤال I think you covered in your answer اللي هو كيف أقدر أتواصل مع الدكاترة بخصوص الأبحاث؟
إيه، تكلمونهم بعد الكلينكس لو كان عندهم office hours which is rare يعني الحين. تقدرون تروحون لهم لما تشوفونهم في conferences أي مكان. You can email them of course، بس صراحة مو كثير يردون على research opportunity emails. فلما تشتغلون معهم that's the best time to ask them. تكونون أنتم حاضرين معهم عيادة، خلصتوا من العيادة، اسألوهم قولوا إن عندك any research أنا يعني متحمس وأبغى أنشر وأبغى أشتغل، أي شيء تبون مساعدة فيه ولا تبغون نبدأ بحث جديد بطلع أفكار we can discuss this. وبالعكس كلهم أصلا يبغون research consultants ف they're gonna be happy to help.
طيب I think this is the last question. المحاضرة مسجلة من البداية، مسجلة، وإن شاء الله بنرفعها بيوتيوب وبننزلها بتويتر. يعطيك العافية ريم.
يعطيك العافية ليلى، وبالتوفيق لكم كلكم إن شاء الله.